everyone, and welcome back to Inner Power Psychiatry. Today, we're diving into an important and often misunderstood topic, teen mental health. We'll explore a case study of Alice, a 17-year-old who recently had a mental health crisis. Remember, names and details have been changed to protect privacy. Let's understand her story and learn how we can better support our loved ones. Alice, I heard you were at the hospital. Can you tell me what happened?
I was just upset. That's all.
Alice is a high school student who has been battling depression since she was 15. Despite her bright academic start, the transition to high school was tough, exacerbated by bullying and a significant drop in her grades. Alice, what is really going on? How did you end up cutting your wrist?
I was cutting apples with a kitchen knife and accidentally cut my finger. I saw the blood, but it stopped quickly. Then I started thinking, if I lose blood, will I die? Then I began to ruminate, if I die, will my mom be sad? Does she even care if I die? I really did not mean kill myself, I just wonder how deep that I cut, how much blood coming out. Then my mom found me bloody, so she freaked out. She called 911. That's all. I really did not mean to kill myself, I just curious what would be happening if I cut myself.
Alice's response highlights a moment of impulsive curiosity rather than a direct intention to harm herself, a distinction that is crucial in understanding self-harm behaviors among teens. It sounds like you understand it was a mistake.
Yeah, it wasn't cool ending up in a mental hospital. I've learned my lesson.
Okay, how are you feeling?
I am fine. I promise that I am not doing stupid stuff. My mom took away all knife from the house, so now I cannot cut my wrist. My mom is overreacting. That's all. Doctor, I really don't have desire to do stupid anymore. So don't worry about me.
Alice's mother is here.
Doctor, I'm very worried about her. She stays in her room all the time and doesn't talk to me much. I'm scared every day.
Alice's mother, a single parent, expresses her fears and the challenges of supporting Alice while managing work and home life.
I am worried about her. I imagine myself seeing her dead body anytime. What can I help her? Alice is my only child and I am a single mother. I have to work every day, I cannot watch her every day. Please help me. Help my daughter.
Depression among teenagers is a significant concern that affects all areas of their lives. More than just usual adolescent mood swings, it profoundly influences their emotions, thoughts, and daily functioning. Identifying depression in teenagers is often difficult due to the typical emotional fluctuations they experience at this age, yet there are distinct signs and symptoms that should not be overlooked. Recognizing the signs, key symptoms of teenage depression. Change in mood. Persistent sadness. First up, persistent sadness. This isn't just a bad day or two. This is about feeling low continuously, for most of the day, nearly every day. Teens might cry often and for no apparent reason, showing a level of sadness that doesn't seem to lift. Next, feelings of hopelessness or emptiness. It's a sense that nothing matters, that there's no point in trying. This can make everyday tasks feel overwhelming or pointless. Teens might express that they have no future or can't see things getting better. Lastly, irritability or anger. This isn't just typical teenage angst. We're talking about an intense irritability where small annoyances can trigger disproportionate anger. This can strain relationships with family and friends, adding to the isolation. Loss of interest. Social withdrawal. Another significant sign of teenage depression is a loss of interest in activities once enjoyed. It's like the color fades from things that used to bring joy, from hobbies to hanging out with friends. This isn't just about having new preferences. It's a profound disinterest that keeps them from engaging in any activities that used to light up their day. Alongside this loss of interest, many teens with depression start avoiding social interactions. They might begin to isolate themselves, even from their closest friends and family members. This withdrawal isn't just being alone, it's a deeper isolation that can worsen feelings of loneliness and sadness. Decline performance. Academic challenge. Depression can significantly impact a teenager's life at school. Here are some of the academic challenges they might face. Decline in performance at school. Difficulty concentrating on schoolwork. Frequent absences from school or a drop in school involvement. A noticeable decline in grades or the quality of schoolwork often signals trouble. Depression can make it hard to concentrate, leading to poor performance and disinterest in school activities. And it's not just about grades. Depression can also cause teens to skip school or withdraw from school-related activities, adding to their sense of isolation. Low on energy. Physical symptoms of depression. Depression doesn't only affect the mind. It also has physical symptoms that can disrupt a teen's daily life. Teens might experience extreme fatigue and lethargy, making it hard to get out of bed or stay active. Or, they might swing to the other end with restlessness and an inability to relax. Changing eating habit is a significant sign of depression. It can be eating too much or eating too little. In girls, depression can lead to eating disorders as they may feel pressured by their peers to be thin. Frequent complaints of physical ailments such as headaches and stomach aches. Aches or pains that do not respond to treatment. Low self-esteem. Feeling of worthlessness. Teens with depression experience persistent feelings of worthlessness or overwhelming guilt. These aren't just occasional doubts about themselves. These feelings can be constant and debilitating, making them believe they're inadequate or fundamentally flawed. These intense emotions can make every mistake feel like a major failure and lead to excessive guilt over actions that most would consider minor. Alongside these feelings, severe self-criticism is another profound challenge. It involves a harsh and often unjust inner dialogue that focuses on one's perceived faults and mistakes. Depression can lead individuals to engage in behavior that is out of character and potentially harmful. Two of the most concerning are reckless activities and increased substance use. Engaging in reckless or harmful activities. This can range from driving at high speeds to experimenting with dangerous stunts. These actions often stem from a decreased concern for personal safety that accompanies the feelings of numbness or despair in depression. Suicidal ideation. Impulsive decision of death. Suicidal thoughts in teenagers can often be the result of overwhelming stress, depression, or anxiety. These thoughts may vary greatly in intensity, from fleeting thoughts of suicide to detailed planning. Common signs that a teen may be experiencing suicidal thoughts include wondering about life or death, talking about wanting to die or kill oneself, feeling hopeless or having no reason to live, and showing drastic changes in behavior or mood. It's important to recognize these warning signs early. If a teen expresses any thoughts of suicide, it should always be taken seriously. Early intervention can be life-saving. Factors that can contribute to suicidal ideation include mental health disorders such as depression, experiences of bullying or abuse, significant losses, or chronic illness. It's not just one factor but often a combination that leads to these thoughts. If you think a teenager you know might be having suicidal thoughts, the first step is to talk to them openly and honestly. Ask them about their feelings, and listen without judgment. Alice, how are you? Your mother said that you engaged activities that could harm you. What happened? Are you harming yourself?
No, I just hang out with my friends. Nothing serious. I am not trying to harm myself. Just having a little fun. That's all.
Encourage them to seek help from a mental health professional. Treatment may include therapy, medication, or both, depending on their needs. Support from family and friends is also crucial. How to help teens. Key elements of treatment choices. Treatment for teenage depression can be highly effective and often involves a combination of strategies. Psychotherapy. Psychotherapy, also known as talk therapy, is a method of treating mental health issues through psychological techniques rather than medical means. It involves regular sessions between a therapist and a client where they discuss the client's thoughts, feelings, and behavior to address specific or general problems. Psychotherapy aims to improve an individual's well-being and mental health, resolve or mitigate troublesome behaviors, beliefs, compulsions, thoughts, or emotions, and improve relationships and social skills. Family therapy or group therapy can be highly effective in treating teens with depression. Interacting with other teens who are also dealing with depression can provide valuable perspectives and shared experiences. Medication treatment. Medications for mental health conditions, often referred to as psychiatric or psychotropic medications, play a crucial role in the management and treatment of various mental disorders. These medications don't cure mental illnesses, but they can significantly improve symptoms, making it easier for individuals to engage in psychotherapy, handle daily tasks, and lead a more stable life. Here are the benefits of psychotropic medications. Medications can effectively reduce or eliminate the symptoms of many psychiatric disorders, including depression, anxiety, bipolar disorder, schizophrenia, and ADHD. For instance, antidepressants can alleviate symptoms of depression such as sadness, hopelessness, and lack of energy, enabling individuals to function better. Improved quality of life. By managing symptoms effectively, medications can improve an individual's quality of life significantly. People may find it easier to maintain relationships, perform at work or school, and participate in community activities. Enhanced therapy outcomes. Medications can make psychological symptoms less intense and more manageable. This can help individuals get more out of psychotherapy as they are better able to engage with the therapeutic process and apply new learning and coping skills. Support for neurochemical balance. Many mental health issues are associated with imbalances in the brain's neurotransmitters. Medications can help to restore this balance by increasing, decreasing, or modulating the activity of these chemicals, such as serotonin, dopamine, and norepinephrine. Control over acute episodes. In acute psychiatric situations, such as severe depressive episodes, mania, or psychosis, medications can quickly help to stabilize dangerous symptoms. For example, antipsychotics can reduce delusions and hallucinations, while mood stabilizers can curb extreme mood swings. Changing lifestyle. Making lifestyle changes can be a powerful part of managing depression, especially for teenagers. These adjustments can help mitigate symptoms, improve overall well-being, and empower teens to take control of their health. Here are several lifestyle changes that can significantly benefit teens dealing with depression. Regular physical activity. Exercise releases endorphins, which are chemicals in the brain that act as natural painkillers and mood elevators. Regular physical activity can also help regulate sleep patterns and reduce stress. Encourage activities like walking, cycling, team sports, yoga, or any form of exercise the teen enjoys and can consistently participate in. Healthy diet. Nutrition plays a crucial role in brain health. A balanced diet provides the necessary nutrients that influence dopamine and serotonin levels, which are directly related to mood. Focus on a diet rich in fruits, vegetables, lean proteins, and whole grains. Limit the intake of processed foods, sugars, and excessive fats. Adequate sleep. Sleep has a profound impact on mental health. A lack of sleep can exacerbate the symptoms of depression, affect mood, and decrease cognitive function. Aim for 8 to 10 hours of sleep per night. Establish a regular sleep schedule, minimize screen time before bed, and create a restful sleeping environment. Mindfulness and relaxation techniques. Practices such as meditation, deep breathing exercises, and mindfulness can reduce stress and enhance overall emotional resilience. Encourage regular practice of these techniques. Social interaction. Isolation can worsen depression. Maintaining social contact and spending time with friends and family can provide emotional support and decrease feelings of loneliness. Limit screen time. Excessive time spent on electronic devices has been linked to increased depression and anxiety, as well as poorer sleep quality. Set reasonable limits on the use of smartphones, computers, and TV, especially before bedtime. Addressing teen depression requires a comprehensive approach that includes therapy, medications, lifestyle changes, and the support of family and friends. By understanding the symptoms and implementing effective treatment strategies, such as family and group therapy, teens can gain new insights and feel less isolated in their experiences. It's crucial for teens and their families to engage actively in the recovery process and seek professional help when needed. Today, Alice and her mother are here for follow-up. Hello, Alice, how are you?
Hello, doctor, I'm actually doing quite well. I believe my depression is improving. I'm finding myself enjoying school every day.
Are you taking medications and seeing your therapist?
Yes, I take my medications daily and see my therapist once a week. I'm doing quite well with my therapist. She's really helping me think more positively about myself. I'm much happier now. I wasn't sure why I felt so depressed before, but now I feel much better about myself.
Thank you, doctor. Alice is excelling in school and has decided to pursue a degree in psychology at college. She wants to use her education to help others who are struggling with depression.
Wow, I'm really impressed with you, Alice. That's such wonderful news. I'm glad to see you found a way to overcome your depression and improve yourself. Today, we explored teenage depression, covering its signs, symptoms, and various treatment options. Recognizing these symptoms and applying effective treatment strategies, such as family and group therapy, can help teens gain valuable insights and feel less isolated. It's essential for teens and their families to actively participate in the recovery process and seek professional help when necessary. Remember, depression is manageable, and with the right support and interventions, teens can overcome their challenges and work towards a healthier, more fulfilling life. If you found this video helpful, please subscribe to my channel for more content like this. Until then, see you next time. Thank you.